My name is Daniel Heffernan, a senior. I am a family physician, practiced family medicine for 43 years. I think that the Lord put a desire in my heart to serve the poor and the needy. I grew up during the years when there was a lot of poverty around, during the Depression years in the 1930s and 1940s, during the war years, when things were very scarce and there was a lot of poverty around. And the Lord just gave me a heart for serving the needy. So that's been part of my professional life since I began in 1957. As a matter of fact, I started a free clinic in Midland, Michigan for the migrant Mexican-American farm workers who came to the area. And the farmers couldn't afford to buy insurance for them, and these people had no ability to pay for medical care. So I identified that need and started up a free clinic, which went on for most of the decade of the 1960s. During the 1970s, my wife and I decided we needed to move back down from Midland, Michigan to the Ann Arbor area, and I joined a group of family physicians in Ann Arbor at that time. Hope Clinic began here in 1982 when there were a lot of layoffs from the local auto plants, and people were without medical insurance. And so when we saw that need, my wife and I began Hope Clinic, and it started out just as a Saturday morning walk-in clinic for the needy, people without insurance, and it very gradually over the years has expanded well beyond that. In '93, when we purchased this building, I thought, well, somebody has to be there, and that was me. So I decided I'd be there 2 afternoons a week, on Tuesday and Thursday, and I did my full-time practice the rest of the week in the office, and then came down here and brought some nurses and people, and the volunteers started showing up, nurse practitioners and physician assistants and other physicians, and gradually we've gotten a good number of providers, that is physicians, nurse practitioners, and PAs, physician assistants. And we're now up to somewhere close to 80 who volunteer part-time in varying amounts of time. We've been in the new part of our building now almost a year, and we jumped from 5 examining rooms in our older building to 8 examining rooms now, and I think there's enough room for more staff, more clerical staff, more nursing staff, so that I suspect it'll continue growing, and I wouldn't be surprised if it were double or even triple the numbers of people who we see in any given year. That's what I suspect will happen. When we began Hope Clinic, though, 30 years ago, I had no idea that it would continue on and continue to grow as it has. And I think one of the big reasons for that is that people do want to volunteer. People do want to help. They want to be part of a good thing, and this certainly is a good thing to be caring for God's little ones who need more help than some of the rest of us.